when to get a mammogram and what type of mammogram is the best for you. Starting through the technology and sorting through it can be daunting. Dr. Juliette Tay of Boca Raton Regional Hospital joins us to talk more about this and to answer your questions. Thank you for joining us this afternoon.
Good morning.
There's been a little controversy in the past year about when a mammogram should be conducted, the first mammogram.
Absolutely.
Give us the basic guidelines, if you would, please.
The American Cancer Society still maintains that every woman should start at age 40 and continue annually.
If there's a breast cancer history, should a woman start earlier?
Yes, and it just depends on what the breast cancer family history is. And they should talk to their doctors about when they can start, but they can start earlier than age 40 if necessary.
And then women say, oh, I had a digital mammogram. How does that differ from traditional film mammography?
That's a great question. The difference between a digital mammogram and a film screen mammogram is much like the difference between a film camera and a digital camera. In a film mammogram, the image is taken on a piece of film which needs to be developed so that you can look at the image. In digital mammograms, the film is replaced by a detector, so that the detector converts the X-rays into electronic signals, which is processed by the computer, which generates an image on a screen.
Does it detect cancer, though, better, earlier?
In the 2005, there was a landmark DMIST study, which is a multi-center trial that actually discovered that as a population as a whole, digital mammograms perform the same as analog mammograms, but it does. Digital mammograms are better for certain subsets of the population, very important subsets of the population. Women who are premenopausal or perimenopausal, people who are under age 50, and women with extremely dense or heterogeneously dense breasts. These cohorts of the population, digital mammograms was shown to detect cancers more than the traditional film screen mammogram.
That's an interesting observation. It really is. Okay, now we have the mammogram, we have traditional film, we have digital, and then we have ultrasound. Who should have an ultrasound?
Ultrasound is another modality that can help us find cancers also. You know, as when certain women have denser breasts, and that means that the ratio of their glandular tissue to fat is higher, and it's sometimes harder to detect smaller masses. So that if women really feel something and they think that there's something wrong or something different about their breasts, but the mammogram is normal, it's always good to take one extra step and get that ultrasound.
And then what about the MRI?
The MRI that's another good question. The MRI is a new modality in which the woman gets an injection of contrast and then goes into the MRI machine and takes about 20 minutes of images, and then the images are generated. The MRI has actually been shown to have a 99% sensitivity, 97 to 99% sensitivity in detecting cancers. But the problem is that it detects a lot of things that also end up being benign. So it then causes some anxiety for things that ultimately end up being benign. So we kind of reserve the MRI for certain women. We're using it most now for women who have a diagnosis of cancer to see if there's cancer in the other breast or elsewhere in that breast, or women who are at extremely high risk for cancer.
We're out of time, but what you've left me with as a bottom line is talk to your doctor, get your questions answered. Thank you so much, Dr. Tay.
You're welcome.
Boca Raton Regional Hospital sponsors our expert, our doctor, and also underwrites our Ask the Doctor segment. Back with more in just a moment.